Joseph McKellar, RN, with Spring Arbor University, Nursing 442, and today we're going to be talking about diabetes. Diabetes is the seventh leading cause of death in the U.S. It is a progressive disease where the body loses its ability to utilize blood sugar properly. Now, there are two types of diabetes. We have diabetes type 1, where the body does not produce insulin, and we'll talk about what that is. Type 2 diabetes, where your body does not use that insulin properly. We call that insulin resistance. Now, normally we have the cell, we have insulin, and we have our blood sugar. The cell calls for fuel, and the insulin, in the form of this truck here, grabs hold of the blood sugar and drives it right into the cell. That is the normal course for us. Now, in type 1 diabetes, the problem is that we don't have these. We don't have this carrier to bring blood sugar into the cell because blood sugar can't go in there by itself. It needs something to take it in. And the reason for that is because the pancreas, which produces the hormone insulin, is not working properly. So now, if the blood sugar is in the bloodstream and cannot leave it because there's no trucks, the blood sugar accumulates in the bloodstream, and that can be very serious because it can make the environment more acidic, which could damage cells, ultimately damaging organs and the organism itself. How do we, in a generic fashion, fix that? Well, we add our own trucks. Through injections, we add insulin into the person's body, which then the insulin can grab the blood sugar and take it into the cell. In type 2 diabetes, it's a little bit different here. In type 2 diabetes, the pancreas was working, but it's been stressed in the sense that through our diet, through maybe lack of exercise, through obesity, and through genetic factors, this blood sugar has been accumulating in the bloodstream, and the pancreas has been working the best it can by producing more trucks to rush the blood sugar into the cells. But over time, these cells become resistant to the insulin. Maybe they're just tired of all these trucks driving in and out. But no matter how, what happens is it becomes insulin resistant. That insulin resistance causes the blood sugar to stay, once again, in the bloodstream, causing this acidotic situation. How do we take care of that? Well, there's a few factors. Medications are out there to help with getting the blood sugar back to where it needs to be. But some big things is we want to reduce weight. We want to increase exercise. We want to look at food choices, right? We want good nutrition, reduce the simple carb intake and so forth. And those help to kind of keep that blood sugar down and sort of alleviate the pancreas from working so hard in the hopes that we can make those cells more sensitive again to the insulin. So now that we've looked at what diabetes is, let's take a look at the prevalence of diabetes in America. Let's look at the stats. In 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. The percentage of Americans aged 65 and older remains high at 25.2%, or 12.0 million seniors. But what's very startling is that in new cases, 1.5 million Americans are diagnosed with diabetes every year. And that's not including the pre-diabetics, or those people whose blood sugar is just a little bit above normal. They're on that borderline of becoming type 2 diabetics. At 84.1 million Americans aged 18 and older had prediabetes. Some of the common symptoms of diabetes, as you can see on the slide here, we have urinating often, feeling very thirsty and hungry, and extreme fatigue. So why do we have these symptoms? Well, if we have this blood sugar increasing in our vasculature, in our blood vessels, our body needs to get rid of it so it doesn't become toxic and die. So the kidneys are stimulated to help excrete this blood sugar through the urine. We become very thirsty to help that process. We drink more fluids so we can urinate more of the blood sugar out. We feel very hungry, even though we may have eaten already. It's because our body is starving. The cells are starving because they don't have the simple sugars. They're forced to burn proteins and fats, which under those circumstances are very dirty fuels. And we feel extreme fatigue for the same reason. Our cells are starving. They need something more. Now we continue our clinical presentations of the diabetes, the signs and symptoms. So we have blurry vision. Why do we get blurry vision? Well, it's because over time diabetes damages the blood vessels in the retina. And this damage causes the retinal tissue to swell, resulting in cloudy or blurred vision. Cuts and bruises that are slow to heal. Why do we have that? Well, it's because high glucose levels can stiffen the blood vessels, making it harder for blood to flow. This means that nutrients and oxygen can't reach the cells, which makes it harder to repair wounds. In the long term, lack of oxygen can cause cells to die. We have weight loss. Why are we losing weight, especially in type 1 diabetes? Well, because we're burning so many proteins and we're burning the fat because we can't burn the sugars. And why do we have pain, tingling, and numbness in the hands and feet? Well, it kind of goes back to the fact that we don't have good oxygenation. Remember, high glucose levels stiffen the blood vessels, making it harder for blood to flow. That means that the nutrients and oxygen, they're not reaching the cells. And so the nerves become damaged, they become irritable, and that's where you start getting those symptoms. We all need to realize that diabetes, it doesn't discriminate. All people at all stages of life have a risk of developing diabetes. This slide here breaks down the various races and ethnic backgrounds to show the rates of diagnosed diabetes cases. If we look, we see pretty much all of the different cultures that we have in the United States. All of these beautiful Americans here. The highest being the American Indians and the Alaskan Natives. One has to wonder, are we doing enough for these populations, especially those that have these such high percentages? What are we doing to help take care of them through education and through best practices? Now we're going to discuss the health promotion interventions, specific tools to diagnose diabetes, basically through blood tests. The A1C test, for example, measures your average blood sugar for the past 2 to 3 months. Other tests are the fasting glucose, which means you haven't eaten anything in 12 hours, and then you get your blood tested, or the OGTT test, or the oral glucose tolerance test, which is where you drink, you get your blood tested, you drink a sweet solution, and then 2 hours later they recheck your blood to see where your glucose level is in your blood. Now we have some tools that are associated with our diabetes, especially type 2 diabetes or type 1, and then how to prevent diabetes to begin with. Well, what we need to do are two main things, and these can lower the risk of type 2 diabetes by 58%. We can lose 7% of our body weight, exercise moderately, and it shows on the slide here, 30 minutes a day, 5 days a week. But I'm going to say additionally, adding good nutrition, reducing simple carbohydrates, and increasing our vegetable and fruit consumption will also help to reduce the risk of diabetes type 2, but then also that's how we help to keep our blood sugars lower. When we're looking for someone to self-manage their diabetes, and when it comes to patient education, we need to, as health providers, we need to remember to take it slow. We're hitting people with a tremendous amount of information about diabetes. They're stunned by the diagnosis, overwhelmed by the diagnosis. We need to take it slow, bit by bit by bit, but always taking it slow. Help them to get to know their diagnosis. And then from there, once they know the diagnosis, they understand what diabetes truly is, then we can start modifying things with them, helping them with good food choices, helping them increase exercise, reduce weight, learn about medications that they're taking and why they're taking the medications. The more we can help our patients understand, the better they will self-manage their diabetes.